Welcome to The Exam Room, the podcast where we explore how value-based care is transforming healthcare for the better. From probing today's challenges to charting innovative breakthroughs, we're here to dissect what's shaping the future of patient-centered healthcare. I'm your host, Rhiannon Winsor, and we're charting the course through patient engagement. Let's grab in and get started. Joining me is Sonia Sonato, Manager of Programs and Business Operations for VB Care Network and ABC Network. She has extensive experience and remarkable success in connecting with these individuals. Through her work, she's discovered powerful strategies to encourage open conversations and build lasting trust. Thank you for joining us, Sonia. So why don't you introduce yourself and tell us a bit about your role at VB Care Network and ABC Network?
So as you said, Sonia Sonato, Business Operations. I've been with VB Care since its inception. My time here has been spent not just working on programs and operations, but as well as getting involved in the Patient Engagement Center and managing up our Beneficiary Engagement Center that we now have for ABC Network.
Thank you for joining us. This is awesome. I think it'll be really beneficial, the things that we're going to talk about. I have a lot of questions to pick your brain about. So let's start with just some basics about outreach. In your experience, what are some fundamentals or basics of effective outreach?
I think some of the basics of effective outreach are going to be approaching each beneficiary as having a conversation with maybe your aunt, uncle, mother, or brother, rather than trying to convince them to do something that you're looking for them to do. Just talking to them, I think, is the most important.
Yeah, absolutely. So when you are getting ready to contact a patient, what are some initial steps that you take?
We have to do a little background checking. We have to kind of look at their medical history, maybe double check and see if we have the right name, address, phone number, etc., and see if we can get a patient profile on what some of their medical conditions are. Once we've done that, we can initiate a conversation with them and have a better understanding of why or where we might want to take that conversation toward. So depending on what the outreach is for. For example, I do outreach for the HIE files. So those are people who have been recently discharged from the hospital, whether it was in an inpatient stay or an emergency room visit that they were discharged from. That kind of gives you a leadway into the conversation because you're calling them the next day and you say, I'm calling to see how you're doing. They immediately know that I'm following up because they were just released from the hospital. And that leads them to be a little more open in the conversation, which is helpful, especially if I say, I'm calling on behalf of your health center to follow up and see how you're doing today. How are you feeling? That makes them feel like, that's nice. Somebody's checking up on me to see how I'm doing. I always followed that up with, did you have any questions about your discharge paperwork? Because a lot of times people walk out of there, they're so confused. They're still a little groggy. They've been given instructions and they don't know what they're doing right now. So they might have questions about their discharge. And so by asking them that, they know that I'm concerned is if they are doing everything they're supposed to be doing after their discharge. I'll also ask them if they've already, which most likely they haven't, scheduled a follow-up with their PCP, their primary care physician. Now, sometimes these hospitals will schedule an appointment with a doctor that's not their PCP. My goal is to make sure that they're going back to their PCP. And so when the patient says, no, I haven't scheduled that yet, or I've got an appointment with such and such doctor, but that's not my primary, then I know I need to assist them in getting an appointment with their primary so that their primary is brought into the loop of what's going on with this patient's health. That's important. And the patient needs to see that the primary is involved in what's going on in their health as well.
So I'm hearing that you get to know the patient before you even call them.
Absolutely. At least medically on paper. Mm-hmm. Yes.
With your experience, what are some signs that the outreach efforts are working, even if the patient isn't immediately receptive?
With my experience, if they're talking to you, if they're having a conversation, if they're kind of letting you in on some of their personal lives, if they're telling you about their day, how they're feeling, that's effective conversation. I don't necessarily need to know right out of the chute about their diabetes or their chemo treatment they had last month. But if they're telling me they had a rough day today or they had a rough day yesterday, I think that's effective because they're kind of letting you in on the personal side that they've got going on.
What if you're trying these things and they're still not opening up or being receptive? How do you navigate that?
I just reassure them that, one, we're not a scam, and I want them to be proactive on trying to avoid getting scammed. So when they have questions or concerns about why we're outreaching, I just want to reassure them that, one, we're affiliated with their health center, and two, as a Medicare beneficiary, they're entitled to this free service that we're reaching out with, and to let them know that we're here to help them in whatever it is that they need.
So how does active listening play into your approach?
With these beneficiaries, they just want to be heard. They want someone to talk to, someone to listen to them, someone not to judge them. So you always have to actively listen to these patients and what's concerning them. So rather than automatically assuming it's their diabetes that we should be talking about, they may be more concerned about something going on in their daily lives that they feel is more important at the moment. And if that's the case, you need to listen to them and help them try to figure out or navigate how to fix what's going on right now for them. It might not be their diabetes, although diabetes is very important. It may be something we need to address later. So actively listening to what they want to talk about right now is important. For me, active listening means not only am I listening to what the patient has to say, but I'm also catching what their concerns are on what they're saying. I'm catching what's important to them and what's not important. I'm also catching that what they need validation on versus what they already know to be true and they're not concerned with. When a patient's telling me about how they view their health, that's their truth, and I have to go with that. Even if a doctor has told them it's all in their mind, for example, for that patient, it's very real. And we need to recognize that, and we need to help them with that, because in their world, it's real, and it's what's affecting their everyday life. It's what's affecting their quality of life. And we're trying to improve on that quality of life. For me, active listening is not just waiting for them to finish talking so I can respond, but listening to everything they say, why they're saying it, how they're feeling about it, and what it is that they actually want help with. Because they don't necessarily want help with everything. Some things they feel like they can manage their own, which they have every right to do. But there are other things that they have real concerns with, and maybe they don't know how to ask for help, but they want to ask for help, and you have to listen for that.
Yeah. Listening to understand.
Absolutely.
So let's talk about core mindset for outreach. What would you say is like your main mindset?
My main mindset when I'm doing outreach is that my goal is to only help these people, and whatever that is. So if I'm having a crappy day, that's going to play through in my voice when I call these people. That might not be the best day to do outreach, or I might not be the best person today to do outreach. I want to make sure that I'm coming off as happy and as cheerful and as helpful as I possibly can. I want to make sure that they understand I'm here to help, and I'm going to be a helpful sounding board for them. And in order to do that, I have to be in the right mindset to give them a call. Otherwise, they're going to hear it in my voice. I'm going to be lacking that smile, as they say, that comes through the phone. I talk to them like my neighbor, my uncle, my aunt, maybe my grandmother. I talk to them like they're a human being. They're not just a patient. They're not just a number. They're not just somebody I need to check off my box to call today. They're going to be a friend. And that's building a relationship with them.
Mm-hmm. The relationship building, that's the key, I think.
Absolutely.
Thank you for joining us in The Exam Room, where we examine the vital signs of value-based care and diagnose what's shaping the future of healthcare. We hope this conversation on patient engagement was as insightful as your last checkup. A big thank you to our guest speaker, Sonia Sonato, for sharing her expertise and prescribing actionable ideas. Stay tuned for more episodes as we probe the topics that matter most in value-based care. I'm your host, Rhiannon Winsor. Until next time, take care, and thanks for listening to The Exam Room.